Uh, a career in medicine. It was a very long and drawn out process for me. I was an English major as an undergraduate in college, and I ended up finding a job in banking and finance and marketing after college. And I did that for almost 5 years and realized that my heart wasn't in it, that it paid the bills, but it wasn't something that I loved. The night my son was born, my oldest son, I thought to myself, you know, I've never really thought about medical school. I had thought about going back to school for business. I had thought about going back to law school, but medicine had never really been in my list of possibilities. And then that night that he was born, I thought to myself, why have I never thought about medicine? It has essentially everything that I really wanted in a career. I think it's something that has intrinsic value in helping people. I think it affords me the opportunity to teach and the opportunity to continue learning throughout my entire career. Those were all things that I didn't really feel like I had at all in my career in banking. I started thinking also, what kind of example do I want to be for my kids? Do I want to be someone that they can look up to and their dad is someone who does something that he loves and something that's important? Or do I want to be the kind of dad who works to make money to support his family, but that's it? And I knew that, you know, I wanted the former. I wanted to be able to support my family, but in addition to that, be someone that they could look up to because of what I did on a daily basis. So from the first day that I started my neurosurgery rotation, I knew that's what I wanted to do for the rest of my life. It's an incredibly complex field where I knew that I could spend my entire career studying about the nervous system and studying neurosurgery and still know that there was a tremendous amount to learn. It's something that would continue to keep me on my toes. It's also something where I felt there was great beauty and elegance in a lot of the surgeries that are performed. And I knew that people with neurosurgical problems are often very, very sick, sometimes close to death. And one of the important things, especially having gone through my own father's death in that very, very difficult time period, one of the most important things about my job as a physician was to comfort families in great distress. It's important for my patients to know several things about me. First and foremost, I think it's important to know that I deal very honestly and openly with my patients. Getting to the point of seeing a neurosurgeon and contemplating having a neurosurgical procedure is a very trying time in someone's life. And I know that no surgical procedure is perfect. And I treat every neurosurgical procedure that I do with great care and great reverence, which means that not only do I perform the surgery carefully, but also I think it's important to counsel patients accurately and honestly about what the risks and benefits are of performing surgery. What attracted me to Reno was really first and foremost about the entire package. What I enjoyed about the Sierra Neurosurgery Group is that they had a profound amount of respect for what I'm looking for in a career. And with a family and a wife and making a very big move after residency, I'm not looking for a job, or I wasn't looking for a job where I would be for a couple of years. I was looking for a job where I could spend my entire career in one place. And not only to get to know the community, but get to know my patients, and also a place where my kids could grow up and we could spend time as a family. My definition of success is having an honorable life, treating my patients with great care and great respect, being a great husband and a great father.